Hi, my name is Jakeina Sutton, and I am a second year MPH student as well as an intern for HealthyUNCG. Today we're discussing heart health in minorities, and we're joined by Octavia Hicks. Hi, Octavia. Thank you so much for joining.
Hi, thank you. I'm excited to be here.
Thank you. We just have a few questions we want to ask and get some clarity on, so we would love to hear your thoughts and perspective. Our first question is, what is heart health or what is heart disease?
So, heart disease or cardiovascular disease is a general term that we like to use to describe the condition of the heart and the blood vessels. It's most often associated with plaque buildup in the blood vessels that can lead to lack of blood flow, lack of oxygen delivered to the body, and then sometimes blood clots.
Okay. Thank you so much for clearing that up for us. Everyone has their own interpretation of what heart disease or what heart health really is. So it's good to hear from a healthcare professional about what it is exactly. My next question is, how does it affect the African American community?
So, as you may know, African Americans often deal with a lack of access to health care and lack of access to healthy eating options, which in turn leads to a higher risk of developing chronic diseases such as diabetes, hypertension, and high cholesterol. All three of those chronic conditions are a major risk factor in developing heart disease. So, what we see in the African American population is a futile cycle of the lack of access to health care and not eating as healthy as we could, leading to those chronic diseases. And a combination of all of that, it puts us at a greater risk of developing heart disease.
What are some ways or lifestyle changes we can do to prevent heart disease?
So, heart disease is not really caused by one thing. It's caused by a combination of things, which we call risk factors. Those risk factors include smoking, obesity, unhealthy eating, sedentary lifestyle, or lack of exercising, among some other things. So, controlling those risk factors is the best way to control and prevent the development of heart disease.
Heart disease is for old people.
Oh, this is such a myth. Heart disease can affect anyone at any age. We often equate it to old people because that's what we see, especially in the commercials or infomercials talking about heart disease. But it can definitely affect anyone at any age.
Okay. It's good to get that cleared up. Like you said, we see so much misinformation out here, so we just don't know what's a myth or what's the truth. But once again, thank you so much for clearing that up. Another, is this a myth or a truth? Heart disease run in my family, so there's not much I can do about it.
I hear this so often, and it's so a myth. Heart disease, yes, there are genetic components, but there's absolutely things we can do about it. We just talked about the risk factors leading to heart disease. So, controlling those risk factors, controlling our chronic diseases such as diabetes, high blood pressure, and high cholesterol, there's absolutely things we can do about it to prevent our risk of developing heart disease, even if it runs in your family.
Awesome. Well, thank you so much for clearing that up for us. We appreciate that.
Heart disease.
Like I said, there's a lot of misinformation out here, so we just want to kind of clear things up and get people on the right track about their health, especially with this month being heart health. Any suggestions that you would like to give for people to better take control of their health?
Yeah, absolutely. So I am a women's health physician assistant, and I love telling my patients no matter what type of insurance you have, you are guaranteed one annual wellness visit a year. And in that one wellness visit, you can have your blood checked, you can have your cholesterol levels checked, your blood sugar checked, as well as your blood pressure. So getting all of those checked, asking your medical provider, what does those numbers mean? What does that mean for me? How can I make my health condition better? I see a lot of patients shy away from asking questions or leave their appointments not knowing what was going on simply because they didn't understand. So ask questions if you don't understand what was said. Ask your provider to break it down into smaller words or into a way that you can understand better because ultimately you are in control of your own health.
Yes, that is so true. Advocating and, like you said, just asking those questions that you may be afraid or shy to ask. No question is a stupid question, especially when
Absolutely
it comes
not.
to your health. So, if there's a question or something you don't understand, there's nothing wrong with asking your provider to better explain that information for you. We want to make sure that you guys have the correct information
Yes.
and have those tools and resources available for you to better take control of your health, or get you going into the right path. So thank you so much for shedding light and joining us on this conversation for heart health in minorities.
Thank you for having me.
Hello, my name is Dr. Aiyanna Archer, and I have the pleasure to speak with you all about how mental health and stress can affect our hearts. One of the things we want to hone in on is that when it comes to stress and mental health, it signals something to our brain. It signals to us that something is happening, something is off, and we need to fix it, which means our body is letting us know that we need to fix it. When stress is happening in our bodies communicate to our brain to produce adrenaline. In that adrenaline, it then signals to our heart to pump quickly, and that can produce palpitations. And because your heart is pumping so fast and so quickly, so frequently because of the stress, it then can weaken our heart, exhaust our heart, and that can cause everlasting diseases or heart conditions that we could have possibly prevented over time. So all in all, when it boils down to stress and mental health and your heart, it should be safe enough to say that caring for your mind will likely lead to less stress and lead to an everlasting, long-lasting heart. Thank you.